am gonna show, I'm gonna let my kitty actually see kitty. I don't know if you can see kitty or not. Maybe.
It should be.
She is sitting here and it's a very good kitty. This is Fire. Anyway, she's in pose here and she's getting ready to take off, I can tell.
I can tell.
But she's also enjoying herself. This video is not actually about her, although she is cute. That was her lap cat half an hour. Anyway, I have been enduring a lot of pain in the hands since about May, late April, early May, something like that. Anyway, I taught Sarah to give injections earlier this year into my fingers after I accidentally got scratched. So I just wanted to make sure I had like antibacterial activity in and around the scratch. For what it's worth, if you have a cat or animal, it's best to not let them scratch you. It can cause serious illness. Anyway, many people have, because I brought up bee venom injections and therapy in terms of energy medicine and trying to duplicate it. So I actually do want to tell how it's done and show it so that way you can use it imaginatively. So basically, when she does this, she draws back bee venom. It depends on how many stings you want. In my case, I'm doing 1.5, I think. And so 1.5 stings. And then what you do is you put like 3.5 portions of lidocaine into that same syringe, and so it equals actually altogether it's an entire syringe full of medication of 5.5 units. Sorry, it's a bit, I'm going to call it 5 units because it's just easier. So then after that you can actually do different types of injections with bee venom, but it is typically not used the way that say that Charlie has talked about, the corticosteroid injections that also have lidocaine in them. That's not the same way that bee venom is used. So for anyone using it, they may misunderstand and think that they can, I mean, I don't think it matters, but it kind of does. Because this is a transdermal injection. If you're going to imagine a bee sting, it's completely different. And yeah, you can just kind of randomly do it. But this is a very specific thing in medicine, so I kind of want to point it out. I don't know if this thing's going to die on me because my camera is ridiculously full of cat videos. So if it does, I'll just do it again, you know, because I know it's possible.
I might have taken the rest of the lidocaine.
Okay, it's okay.
Okay.
So we're not going to worry about whether or not there's enough lidocaine in there because there's nothing we can do.
I got most of it.
Do you want? It has to be here, doesn't it?
Huh?
Does it have to be here so it's in view?
It's a little bit more in view when it's like that.
Okay.
I think I can still do it.
Can you still do it?
The injections?
Okay, yeah.
Yeah,
I just want to know if you can still do it with that type of positioning. Okay, so this is a transdermal injection. It's almost no angle to the needle. You're just going to go in. And then you make what's called a wheel on the top of the dermal layers of the skin. I think that's why it's called transdermal. So there she goes. She's going to put in 1 out of what's in there. You could not get 5 in, but for purposes of this, you're going to pretend there's 5 in there.
Try to roughly split it into 5.
Don't worry about it. Even if it's 4, I don't care.
Okay.
Makes it harder to have to. Okay, so there's 1. You can see what happened to the other side, maybe and maybe not.
Sometimes when you do these, they bleed just the tiniest bit too. But
yeah, they do bleed.
Because it can be hard to go really.
It's also a blood thinner, so sometimes it can bleed regardless.
Yeah.
That venom is, sorry. We didn't do this on the other side though. So I don't know if you want to just
Did you
put
want me
half
to
in there.
do there or do more on the middle finger?
Well,
like
part of
we
the reason
did
I had
last
to
time?
do that is because it's so bad.
Or is it hurting worse on this side of your thumb?
Actually, the other side hurts worse. So you can do that.
I can try to split
You can
little
try
tiny.
if you want. You don't have to. Anyway, if you're trying to do that on somebody, you don't have to imagine much. Having said that, you could try to imagine just injecting deep into the joints with venom or washing into the joints. Anyway, I'm doing that for other people that might be curious or interested in. And I'll level with you. It's if you want to do this type of treatment, if you don't have lidocaine or Procaine, it's going to hurt you more. This is not a pain-free therapy, although, I mean, I'm trying to imagine it because I've never done it on anyone else, except for with bees, and that hurts, you know. But I stung, like right here with an actual bee. I don't know if you can see in the camera, but I stung on my middle digit and the middle finger and first digit here. And just wow, you know. Actually, it was the other side, so I could still feel the pain in my knuckle, and it's not necessarily from that sting. I'm just gonna say how I'm feeling right now. I'm only doing this demonstratively for other people that might want to do energy work. I'm having a lot of trouble, and so anybody out there that's willing to try and be consistent and, you know, go for it, you know, if you want to try on me for hands, but I'm very discouraged. I haven't seen any type of benefit in 2 months from anywhere. And so it's really been disappointing to me. And I'm honestly, I've been very close to just shutting this group down. Not because of what people might think. I can't handle what's going on in my life, and then the lack of like actual trying in group. Like, we all joined this group for a reason. So I kind of feel like we need to try. And trying to me actually means sometimes using video too. Even if you're not talking. Even if you use text for like, because that way you can actually be there and be present. I actually think it might work better. You know, so anyway, I'm going to stop it right there. I'm not going to go on a big soapbox. My depression is just, it should be fairly obvious. So take care. Bye-bye.